I think the big thing that I would say is that remember that this emotion does not last forever. It's like drinking a glass of water. Eventually that will be gone. So try not to stay there too long. My 11-year-old actually said the other day, if somebody has emotions, you need to sit through the emotions, but just let them pass. Don't fight it because that will take longer. So let them live through the emotion, let it be, let it happen, and then try to figure out, why did I have that emotion? What can I do to fix it? And you need to find one person that you can talk to, one person in your life. I have multiple best friends, but they each have a purpose. So some of them I call on when I need to cuss and swear. Some of them I need to call on when I need prayer. They all have a different purpose. So find that one person that you can confide in that you know is not going to be judgmental, and they will just let you be. And it's not going to be the person that just tells you that it's okay, that everything's going to be fine, because nobody can say that. It's not going to be fine. There are days when you're going to be anything but fine. But you will live through this, because so far you are 100 to 1. You are 100%. You have lived through all of your toughest days. And don't let this be your last one.
Okay, everyone, welcome back to Living the Next Chapter. I have a great author, podcaster, everything all in one here today on the show. And you can go and support this amazing author and podcaster through her website, because she set up Buy Me a Coffee. And I'm so excited because this is a great way to support another great content creator in the world. And it's so great to have Mandi on the podcast today. Mandi, welcome to Living the Next Chapter.
Thanks for having me, David.
It's exciting to have you here. Let's start off at the beginning. Where are you in this big world of ours? I
am in the chilly Midwest, right in Minnesota.
There you go. Beautiful. And we talked before we jumped on that the eclipse eclipsed us yesterday, and you and I both had cloudy skies, which was fun. We didn't get to really see too much, but we got the effect of it. That was kind of weird how everything goes dark in the middle of the day and then back to light again. Yeah. I was saying my animals had no idea what was going on. They're standing in the backyard looking around like, why is it dark? Is it bedtime? Yeah, so it was really fun. But great. I'm glad to have you here. I want to jump into your story right away, Mandi, because I've had other people on the show in the past, and what you've written about and your personal story has such great impact for people that are listening. And to hear your story, I think is going to help a lot of people. So having you here is a great honor. So thank you for making time to do this. First, let's start off with the name of your book and what you're doing in the world, because I want to start there, and let's get back into the story a little bit and share a little bit about that. But first, tell us about the name of the book.
Yeah. So the book that I'm working on right now, it's actually in the review phase. It's the working title that I have is, I'm pretty sure this is what it's going to end up being. It's called Welcome Back, a TBI recovery story from provider to patient. So I have a little temporary cover there that shows up very well. Welcome back comes from the big phrase that my 14-year-old started, and then the whole rest of my family and friends started coming up with, again, also after I started getting better. And that's kind of how I start the book off as well, is kind of saying that where the welcome back came from, but okay, now we have to back up to see, where did this actually start? And a year ago, almost exactly today, actually, I was in a car accident and suffered a traumatic brain injury. The irony of this is that I have been working as a neuroscience nurse practitioner for the last 12 years. And I've been in neurosciences to some degree since back in 2000. So 25 years that I've worked in neurosciences. And then I became a patient myself. And in the process of going through that, I learned a lot more. I thought I knew what I needed to do for patients that had concussions and TBI, but I've learned so much that even the providers that taught me how to be the provider that I am didn't know as much as we possibly could have to treat people. And there's so much more that we could do. And that's where a lot of the inspiration came from to write the book.
Okay, so when we talked in our pre-chat, you were mentioning that even on the day of your accident, you were doing like something that was like the next level for you in your career and your knowledge and everything. And then this happens. What were you doing the day before? Something big was happening for you at work, and what you were doing? Talk about that a little bit.
I had worked in neurology for most of my practice up until that point. And a month before the accident, I had switched to neurosurgery. I had always wanted to add this surgical component, and I finally had the opportunity. And literally the entire time in my healthcare career at this point. So up to 24 years when the accident happened, I had always wanted to see brain surgery. That was a big dream of mine. I always wanted to get in there, see it, see what's going on, because it always just seems so exciting. And the day of the accident, actually, I was scheduled to shadow one of our physicians just in clinic, but he ended up having a surgical case added in the afternoon. So I asked if I could tag along. He said, absolutely. And I literally got to be right next to him as he was doing brain surgery, removing a tumor on somebody's brain. And it was the most exhilarating experience I've ever had in my career. I've had a lot of really exciting moments, but this one was like the highest of highs that I could have in that experience, because I was doing the exact same thing. I wasn't participating, but I was there watching it, something that I had wanted to see for 24 years. And then hours later, we were in the car accident and my life was forever changed.
What is it about the brain for you that is so intriguing, so captivating? What is it about that? Like, you could have been doing pediatrics or something completely different. Why this?
It's kind of funny how that came about, actually, because when I went into nursing school, I thought I wanted to maybe be an OB nurse. And I also loved cardiology. And when we went through that rotation, it was amazing. It was super cool. And then I got an opportunity to work on the neurology floor at the hospital where I was. And I just fell in love with the stroke patients that we had, the Parkinson's, everything. Just no two patients are the same. So you can have two patients sitting next to each other in the same room. Their imaging looks exactly the same with a stroke on their brain, but their presentation will be very different because of how their brains are wired. And I think I love it so much because the brain is the last frontier for us. We don't know what all the brain does and how it all works. We have an idea, but everybody's brain works so different. Everybody's chemistry is a little different. The wiring works a little different. If you've had an injury, it has to rewire itself. So it's like the greatest electrician in the world created this thing, and we still don't know what his plan was. And it's just, I think that's what intrigues me about it. But right now, that's the exact same thing that frustrates me about it, is that we don't know how it works. And that everybody's brain is so different.
Could you have left us a manual, something that we could just thumb through and go, oh, yeah, there's no manual to this?
Yeah. No, yeah, because it is so different, and you never know. It's like when we start a patient off on a new medication, you never know how it's going to work for them because it may or may not work for that particular person. So it's, for lack of better terms, it's like a crapshoot. What's going to happen in the brain? And we have an idea. And I was always excited when I could see an image of a patient that I was taking care of. And I'd say, okay, so I suspect that these are the things that I'm going to find. And I would find some of those things when I'd go and do my exam on them. But there would be some other things I'm like, well, that doesn't really fit the bill, but okay, I'll go with it.
What's it like to go from being the caregiver to being given care? Like, that's like overnight. That's not a long process, right? What is that? You're in the hospital. What happens?
It's, my first instinct is always to joke around about things. That's my coping mechanism. So when I'm in pain, when I'm frustrated, scared, anxious, whatever, I joke. So in the ER, I was joking with the providers. I'm like, hey, I just got hired to work here in the hospital and cover neuroscience. So I know who's on call if you need to call somebody if something's wrong with my imaging. So I joked about it at first, but having the next set of everything was not a joke. It was like a comedy of errors in some ways, but so not funny. As I was going through, I reached out to one of the neurologists that I know and love. He's a great friend of mine, as well as a former colleague, and said, I think I might have had a concussion. Can you just see if you can check me out a little bit? He worked me in on one of his lunch breaks that week, and he identified I had problems with my vision, I had problems with my balance. And then he looks at me and he says, did you know you had these? And I said, no. It was really weird losing that knowledge that I sat there and I thought, I'm like, I should know these things. I should know what to do. I should know how to talk to people. But I couldn't even advocate for myself very well because I didn't know what all was wrong with me. It was like a blinder had been put on and I didn't know all the deficits that I had. And we peeled back so many layers over the next 6 months. Just when one thing would get better, we'd realize that something else was not working. We just couldn't tell before because the other problem was so much bigger.
So I know on my keyboard here in front of me, I can hit Control, Alt, and Delete at the same time, and I can remove something from my computer just in that 3 little step process. And this kind of happened for you. This Control, Alt, Delete happened with you with your medical background and your knowledge and what you knew. Like, How scary is that to go from being in the operating room watching a miracle happen in front of you with a doctor to then having pieces and parts of what you know just erased from your memory?
It was mind blowing, I guess. I can't even put to words like how it felt initially, because I was scared. Every day that went by, I kept thinking about how when I was taking care of patients with concussion and TBI in the past, some would get better within a few days, some within a few weeks, few months, years, and then there was that percentage of patients that never got better. And every day that went by and I wasn't seeing improvement, I started worrying more and more that I was going to be that latter part, that things weren't going to get better. And then I kept thinking about how much debt I still have paying for the degree and all the certifications that I've gotten. I'm like, I still have to pay that back and I don't get to use it. And here I am not having been able to use it for the last year. And I didn't realize how much I identified with that title of nurse practitioner until I haven't been able to do it. And so it's like I lost a big chunk of who I am. And beside that, just because of the injury, my humor isn't the same. My personality isn't the same. So I've lost several parts of myself that I'm hoping I can get some of that back and kind of get back to being a little bit more of me. But it's been a process of trying to learn to accept where I am right now and identify that whatever happens in the future will hopefully be a better version of me. And then I can hopefully take some of the things that I've learned in this process back with me whenever I do get back into practice. But man, the grief that you go through when you lose a big chunk of yourself, it's like when you lose a loved one and you go through all the stages of grief, but you're there grieving yourself.
And we talked too in our pre-chat, and it was a powerful conversation. I have notes upon notes in front of me here. But when we chatted, we talked a little bit about the fact that you had materials that you had written and produced and put out into the world around your knowledge, expertise, and what you've learned. And then you're reading these things and experiencing them as a stranger to your own content. Mm-hmm. And you're like, those are your words, but you don't understand the words you're consuming that are your words in that moment. That stuck with me. I went up to my wife and I explained it to her, and she's like, that's got to be the most surreal moment to be looking at your own information and you don't even know what's happening in there. Mm-hmm. Explain that to us. Like, what was that?
Surreal is a really good word for it, actually. I tried looking back on some of my review books that I have on my bookshelf, and it felt like a foreign language there. And I thought, you know what, I've got all these presentations. So I started digging through my computer and pulled up some of the PowerPoints. And I've never been one to read word for word off my PowerPoints. I put little teasers up there, things to remind myself of what I want to talk about. So looking at those presentations, I'm like, what was I saying there? What was I trying to convey? Because I didn't put enough that I could learn from it now. If I wasn't in that presentation taking notes, there's no way that I would have been able to take out of that what I was trying to put out at the time. Because I did talk, I told stories, I used experiences to describe what was on the PowerPoints, and I couldn't understand what I was trying to say. Now, it just didn't make sense. And I actually forgot that I had given a presentation. So 5 years ago now, I had given a presentation at the Minnesota Brain Injury Alliance Conference because they work in partnership with the Minnesota Stroke Association. And I gave a presentation about how brain injury, TBI, and stroke work together, how they affect each other. And I completely forgot that I did that. I forgot about this organization. Facebook reminders, all those things that say, hey, you did this. Remember you did this on this day? That popped up. And I thought, oh my gosh, how did I forget that this organization even existed? How did I forget that I gave that presentation? Oh, and by the way, I took that presentation and I recycled it, and I actually presented it on one of my podcast episodes over a year prior to this as well. So I'm like, I did all these things with this, and I forgot that I even did it. So I started trying to listen to the podcast episode too, and it was brand new information to me. And I had done months of research leading up to that presentation.
Wow.
It was just bizarre.
Imagine the full circle moment for you now to go back on stage with that same organization, mm-hmm. now with this hindsight, this story, mm-hmm. and address the same group of people, mm-hmm. returning. That would be power.
So I actually got to. at the beginning of March.
I didn't even know that.
A little over a month ago. Yep.
Okay, come on. Come on.
I had somebody from the Brain Injury Alliance come and talk on my podcast as well after my accident, after I started getting back into the podcast. And after our conversation, he messaged me again like a week or two later and said, "Hey, we're planning this conference again for brain injury survivors, and we'd like you to come present and come be a speaker." And that was my first time being back on stage, first time being back in front of people. And there was 80 plus people in the room, all either TBI survivors or their family or caregivers with them. And all of the nods, the yes, the clapping, every time I would give an example of my symptoms, they all felt the same things. They all experienced the same things. So even though we all have a different experience with it, we all go through the same experiences, if that makes any kind of sense. And it was very emotional giving that presentation to other people that knew what I was going through. And I got to connect with them at a different level that their normal providers don't get to. And they had so many questions for me. They came up afterwards and asked me so many questions. And man, did I hit a wall after that, but it was so worth it. It was so rewarding being back there.
Wow. Before we hit record today, you mentioned that you're seeing some improvement just recently as well. Yeah. Can you give us an update on your story? Like, where are you at today?
Yeah. So the exciting part about it, I think in the process of preparing for that presentation a little bit, that helped me kind of process some of it. And I went through that presentation multiple times a day for the 2 weeks leading up to it to try to help myself remember what I wanted to say. And by doing that, I actually gained a little bit of memory. So I could remember what was going on. One of my slides didn't want to work during the presentation, and I stopped for a second and I thought, and I was able to come up with the information that I wanted to talk about on it.
Wow.
And a couple months ago, that never would have happened. A month and a half ago, that never would have happened. And all of a sudden, I'm having these moments now where things come back to me and somebody can say something medical and I can keep going with the conversation. And I kind of look around and I'm like, where did that come from? Because a year ago, I couldn't make those connections. There was nothing working. So those little neurons are finally going back together.
Mandi, take a few minutes and talk to the caregivers that are listening to our conversation, because maybe their loved one can't explain to them what you're able to explain to us right now. Mm-hmm. And in the frustration of not being able to express what it's like to Control Alt Delete and remove a piece of your memory like that, they just can't share with their loved one what they need in this moment. What do caregivers need to know? What would your message be to a room full of caregivers around TBI and all of this? What do they need to know?
I'd say stop and pay attention. My husband was, I got to hear front and center from him. I actually had him on my podcast as well. And we talked about how it affected our relationship as a couple. And he gave a lot of insight that I never would have thought about. But it was hard for him to admit some things. Initially, he didn't know what was going on. He didn't realize that I had so many issues. And in all honesty, he thought that I was faking it because it was not obvious to him. He was off working all day long, and he was then picking up extra jobs outside of his normal full-time job to try to help pay the bills initially, because we didn't think I was going to be off work that long. Didn't think it was going to be a big issue. So he thought I'd just pick up a couple side jobs and get set financially and we'll be okay. And then he just kept getting frustrated. Well, why aren't you getting back to work? You seem fine. Yeah, you got a headache, but you seem okay. But he didn't really stop to really pay attention to what was going on. And it wasn't until a few months in that he actually saw me physically hit my wall one day when I'd done too much. I overdid it and my face went blank. I was kind of staring off into space. I started slurring my words, stumbling, couldn't stand up straight. And then he thought, oh, there's something bigger to this. There is something more. It's not just that my wife that I've never seen not want to work, doesn't want to work. And it was a very eye-opening experience for him. So after that, he became more attentive. He was paying more attention. So he would watch me when we would go out and do any kind of activity so that he could see when I was starting to hit my wall and say, okay, it's time. Let's go home and get you some rest. Yeah. So as the caregiver, as the family members, you need to, for one, give the person a little bit of grace, but for two, just kind of stop and take notice of what's going on, because when someone has a brain injury, they don't know what all happens. The phrase that I use all the time now is, I didn't know what I didn't know. I didn't know that I couldn't speak quite as clearly. I didn't know that I wasn't conveying my intents and my needs very clearly. And when I went to my doctor's appointments, I would forget to tell them things. So now, I think it was 9 months in, we finally got my husband an intermittent FMLA so that he could come to my doctor appointments, because I needed somebody there to hear that information and to help me make sure that I conveyed everything to my providers. So be there, be an advocate, speak up, watch, just see what's happening and notice what's going on with your loved one, because there might be just subtle things that you notice that they don't.
Yeah. Amazing. Just as a little sidestep, I've been listening to your podcast. Can you talk a little bit about your show and maybe like what your plans are for the podcast going forward?
Yeah. So I actually started the show 6-7 months before the accident. I've loved being an educator in different roles that I've been as a nurse and nurse practitioner. And I wanted to share that information beyond the walls of the facility that I worked in. So I started this podcast. It's called Brain Wellness, the podcast. Not really a too catchy of a name, but it was the whole process of it. I started a company called Brain Wellness Solutions, and my plan was to take different facets of education and give it. The podcast was one of them, so hence Brain Wellness, the podcast. And then it was going to be a series of books. So I actually had one that I'd written last year before the accident. Migraine Help from a Unicorn Nurse Practitioner, part of the Brain Wellness, the book series. So then people always ask, well, what's a unicorn nurse practitioner? And I actually had patients and their families call me a unicorn, because if you think of a unicorn, it's something that's unique, it's hard to find, it's sought after. I always took time and listened to my patients, and I let them explain themselves. And I always wanted to include the family members in it. And I would think outside the box. I was that provider that didn't just say, well, these are the boxes we have to check, and you have these symptoms, let's give you this medication. We looked at the why. Why are you having this? What can we do lifestyle-wise that might be more effective than your medications? And so they started calling me a unicorn. So I picked it up because I'm like, you know what? I like it. I like unicorns too. So that works. So I had all that in the works. And on the show, I've interviewed both providers in either neurology, neurosurgery, or mental health realm, anything that affects the brain, or people or their family members of those who live with those neurological disorders or mental health disorders. So we've talked about a lot of different things, and I love having people come on and share their story about living through the diagnosis that they have, or if they don't have a diagnosis yet, they're having issues, how to take the steps to get the diagnosis. And if it's the provider, trying to bring it down to a level that anybody listening to the show can get some benefit from it. And it's just been so much fun. Before I switched jobs, I had a lot of interviews all lined up, and I got a lot of them done because I wanted to focus on my orientation for the new job and not have to worry about doing the interviews when I got home from work too. So I just wanted to be able to put the show out. I had 6 months of interviews recorded, but all I had to do was release them. And thank goodness I had that, because there's no way that I would have been able to have a conversation in those first 6 months and have it make any kind of sense. I couldn't track conversations. I couldn't follow. I couldn't finish my thought process. I would struggle to come up with words. So I couldn't be the interviewer in that show at that time. When I came to the end of the interviews, I had started doing some outside the box treatments. We did red light therapy. We did transcranial laser therapy. And those things improved my energy. They improved my language ability. So I could speak, but I still couldn't comprehend what I was reading. So I wasn't quite ready to be in the interviewer role yet. And I had one of my good friends who is a mindset coach. She came on and she interviewed me for the next 4 episodes. And we talked about my experience. I shared about the accident, about the struggles that I was having, little bits of what's going to be in the upcoming book.
Good.
And then when I felt ready to interview, the first 2 people that I interviewed was the co-founders of the company where I go get the red light therapy done, to talk about why they did that. And then I had my eye doctor come on and talk about vision issues with concussion. I had we talked about lots of different facets of TBI for the whole next series. And then when I struggled coming up with other speakers for that, I opened it back up to all of neurology like I've done before. But I love those TBI stories. So anybody that reaches out to me and wants to share their story and talk about the TBI, I love how we can connect and kind of create our own little community on that. Yeah. So it's kind of creating that little sense of community with TBI, but as well as all the rest of neurology as well. Next month is stroke month. I'm going to have one of my friends come on and talk about stroke. So just kind of featuring all the things that I loved again. And now that I'm finally starting to see some of those improvements, I feel more confident in my interviewer skills again too.
And that's a big thing about podcasting. It's a legacy too. It's a legacy project. And the fact that you could now listen to yourself on your own show, speak life back to yourself in that moment. That's like, again, another full circle moment as well, that you were able to then in that moment support yourself when you needed that support. That's amazing. So again, the power of podcasting, everyone. It's amazing. Okay, let's jump into the book. What's coming, and let's talk a little bit about it, and then maybe the time frame for the book as well. But again, what's the title of the new book? Yeah,
so Welcome Back is the main title, and then the subtitle, A TBI Story from Provider to Patient. So to try to kind of set that apart. There have been, I've looked and there have been a couple other authors that have written about TBI experiences, but nothing quite like going from being a provider in neurosciences to being the patient. So it's got an interesting spin on that part of it. But each chapter kind of focuses on a different struggle that I faced that can be very much shared. As I started sharing on social media, I had one of my other good friends was in a car accident a couple of months after me, and her experience kind of mirrored what I had. So she kept, every time I would share something, she'd write me a message, thank you for sharing that, because now I know I'm not alone, and it makes me feel not so alone. So I wanted to share so that people wouldn't feel alone, so they knew that they can happen to anyone. And these are the things that I experienced, and they're very common threads that I've heard from other people who've had TBI. So just being able to read that from a different perspective, and it might be great for caregivers to read, just because then they can see what's happening inside the brain of the person that's experiencing the TBI. This is where I was coming from as the patient, and then throwing in there some little bits about this is what I would have known as a provider, but I didn't know to share this with my patients, and my providers didn't know to share it with me. So now I know information to bring later on. There are some dark times in the book. There are some really good times in the book. There were a few months in when I really struggled, and I thought I would have already been back to work. We were financially struggling. My mental health tanked. So I got very raw in the book sharing about that, just because it's not something that you would understand unless you've been in that experience, or unless you could hear it in detail. Perhaps that might help you a little bit, because it's a different kind of depression than anything else. It comes from the brain injury itself. And I lost a lot of control of my brain at that point. So there were some thoughts that I'd never had in my life before, just because my brain was playing tricks on me. And thank goodness that I've kind of pushed people always to get mental health help when they need it. So that I knew to do that as well. I'm like, I know that I can't pull myself out of this. I know that I need help. So talking through that in the book was really, really emotional, but all at the same time, it was really good to get that out so that I could see that, yeah, that wasn't me. That was my brain that was doing that. That wasn't something that I would ever do as me. And it's interesting now, looking back through it, now that I can actually comprehend a little bit more of what I'm reading. Because, well, for one, when I was reviewing it the other day myself, I thought, oh, okay, that was bad grammar. We're going to take that out of there. But I have another friend who's reviewing it for me right now as well before it goes into publication. I'm hoping to have it out within the next month or so here.
Okay.
Because I think it's a good just lesson about what happens to a TBI patient, what goes on in their brain, but then also what can we learn from it? What can we do better?
Yeah.
And as I showed my husband the front cover the other day, he said, well, I'm looking forward to part 2 of it, where you talk about welcome back for real, like completely, so that we have you back there, all
nice.
Going back from the patient back to the provider again. So that's the plan, is that once we have a whole lot more improvement and I'm back to work, then I can share what the rest of the story looked like and how I overcame some of those different things.
How do you think you'll be a different caregiver on the day you report back to work for the first time and swipe your clock and you punch in, step onto the floor for the first time and see your first patient? What do you envision?
Yeah, I think I will never take anything for granted anymore. As I've gone to my occupational speech appointments, all of the different therapy appointments, I have come to realize that my brain was much higher functioning than I thought it was. And it was just my brain. So I didn't think anything of it. I'm just like, well, this is how I work. So this is what I do. And I worked 10, 12-hour days at my full-time job. I had a couple of part-time jobs. I had the podcast. I had all these different things going on. Never mind the fact that I also have 3 children, 3 biological children, plus 1 bonus daughter, and my husband and the dogs. And I would exercise. And I was a health coach at one point on top of all of that. And I literally asked my husband the other day, I said, how did I do all of that before? I don't know how I did that. Because partly I don't ever want to go back to that same level of busy, but I do want to be the best provider I could possibly be. And I've always prided myself on being a good listener, but I think I'm going to listen even more. And I'm going to listen to what's not being said, because then I can see some of those things that they might not be telling me, but I know that they're probably experiencing. And I think I'm hoping that I'll be better at asking the questions that I wish somebody would have asked me because I didn't know how to tell them.
Yeah. Is there anything in your heart or in your thoughts around something along the lines of parenting with a traumatic brain injury? Because I think being a parent on top of everything else is just another level that like the kids won't understand what's going on with mom. Mom is one day mom's like this and the next day mom's like that. I don't understand, but I still need mom to be mom. Yeah. So is there any kind of thoughts in your mind, maybe a podcast episode or something around that?
Yeah, that's probably a good one, actually. I was on another podcast recently. We talked about how to identify if kids are having injuries and how to prevent them from having further injuries. And we briefly touched on what happens if the kids have to deal with their parents having a concussion or TBI. And partly, again, because as part of the book, I got the insight from my kids. I'm like, how did it affect you? And I sat down with each of them and I asked them to give me in their words what happened. Good. My youngest was 10 at the time of the accident. He's 11 now, but he had some really good insights to share. And literally his first thing, he's like, it made me sad. He's like, you couldn't do as much, so I couldn't do as much. Like, that's a really, really simple yet really good way to put it, buddy. And it was very eye-opening to see what they thought about it. We have a lot of empaths in our house, so we all kind of feel each other's feelings. And the kids felt the stress. They knew what was going on, but they didn't quite understand. But even they got really good in the whole process of recognizing when I was hitting my wall and when I was getting too much. And they would say, okay, let's go. So if we went to the beach last summer and we're trying to get out of the house so that we're not stuck in the house all day long, and we could only be there for a half an hour, the kids didn't whine and complain when we had to leave. They're like, okay. They just helped pick things up and we left. Yeah. So they got really good at being mature really fast. But at the same time, my youngest also has autism. So trying to deal with the explosions that can happen with spectrum kids was interesting. Wow. But at the same time, I have a newfound sense of understanding for how he feels, because I have the same hypersensitivities that he does now. So I know that when I can't handle something, he probably can't also. So I think it was a good teacher for me on what my child is feeling, because now I have some of those same issues.
A whole new mom, right? That's amazing. Your story is amazing, Mandi. Like again, from our pre-chat to today and thinking about it in between, I that whole Control-Alt-Delete is stuck in my thoughts. I just can't imagine going from having a knowledge about something that helps people in such a powerful way and having that removed and then trying to bring it back in little chunks and pieces. Your journey is amazing. And I can just tell that being on stage, being on a podcast, sharing your book, doing this today, just hearing your story, there's somebody listening to this right now who's in the dark spaces right now, struggling with that. Maybe they haven't reached out for some help with their mental health, but hearing you say it makes them kind of go, okay, I'll do it. But before we jump off, Mandi, can you just tell us again about the website and the book? Because I have one more question to kind of end our conversation today. But just again, where do we go? And maybe like for the podcast as well, just listening to a podcast might be the one thing we need right now. Just where do you want to send us?
Yeah. So the easiest place to find everything is my website, brainwellnesssolutions.com. On there, I have a link to the book on Amazon. The previous one that I had, the link for the new book, once it gets posted, will be on there as well. I have links to all the podcasts. I have links to all the shows that I've been a guest on. So down at the bottom of the page, I show all the other episodes that I've done on somebody else's show. And all of the links that are out there for all of my social medias. I'm on Facebook, Instagram, TikTok. I share the podcast on all of those different places. Again, podcast is called Brain Wellness, the podcast. It's on Apple, it's on Spotify, Google.
Good.
Everywhere. Yeah.
Everywhere. I love it. Awesome. So for that person that's listening, Mandi, that's in that dark space today, they press play on this episode because of the title, because of your book, because they know I've heard of you, and they're part of your community. What would you like to say to that person that's in that space today, and they just need someone who understands in part what they're feeling? I can't identify with that, and it feels like a weakness to me because I want to help, but you can help. So what would you say to that person that's struggling today?
I think the big thing that I would say is that remember that this emotion does not last forever. It's like drinking a glass of water. Eventually that will be gone. So try not to stay there too long. My 11-year-old actually said the other day, if somebody has emotions, you need to sit through the emotions, but just let them pass. Don't fight it because that will take longer. So let them live through the emotion, let it be, let it happen, and then try to figure out, why did I have that emotion? What can I do to fix it? And you need to find one person that you can talk to, one person in your life. I have multiple best friends, but they each have a purpose. So some of them I call on when I need to cuss and swear. Some of them I need to call on when I need prayer. They all have a different purpose. So find that one person that you can confide in, that you know is not going to be judgmental, and they will just let you be. And it's not going to be the person that just tells you that it's okay, everything's going to be fine, because nobody can say that. It's not going to be fine. There are days when you're going to be anything but fine. But you will live through this, because so far you are 100 to 1. You are 100%. You have lived through all of your toughest days. And don't let this be your last one.
Yeah. Amazing. Mandi, thank you so much for doing this, making time to be on the podcast. Again, I'm really following you with great interest and just love for what you do for people, and the fact that your story can change somebody's life, could save a life, really. Thank you for putting the books out. Thank you for the podcast, and we're following your journey back. And I can't wait to celebrate with you when you're able to walk back into that caregiving role again. It's going to be a great celebration, and I want to be part of that. So Thank you for being part of the podcast today.
Yeah, thanks for this platform. Thank you again.
Amazing. Everyone, all the information, as always, is in the show notes. Go over, listen to the podcast, leave it an amazing reviews, do all that stuff. And buy the books. Support Mandi in her journey to help people. Thank you again, Mandi, so much. Hey, thanks for listening all the way to the end of the podcast. That's a big signal to all of the players, the YouTubes, the Apples, the Spotifys, that you found value in this episode of Living the Next Chapter. Just by you listening to the end, you just sent a huge bat signal out to the app saying this was a great podcast, a great conversation. So you listening to this point, you've done your job. I have one more ask of you. If you know anyone that would benefit from this conversation, would you share this episode with them? Would you just send them a message, send them the episode, tell them about this episode, tell them to go livinginthenextchapter.com to get all the information about the podcast. Can you do that for me? Because the more people that hear this message, this episode, the better. I want to support these amazing authors, and I know you do as well. So sharing this episode really helps, and I appreciate you. See you on the next episode, and thank you for listening to Living the Next Chapter.